Here we go.
And
We're off.
occurred on
Off to the
LinkedIn.
races.
Okay, here we go. We are off. Hey, welcome to another episode of Chiropractic is Sexy. It's another week, another amazing week. I'm Dr. Paula Ruffin.
And I'm Dr. Erica Peabody. And these weeks are flying by. We're almost to 4th of July. Can't even believe it. Next week will be the second when we're here, I believe. Yeah. What
is right? Yes.
Yeah.
Hold on. Let me get this. I gotta load this. There we go. Okay, there we go. What? That is echoing all over the place. Okay, so come on in, hit the thumbs up button. Make sure you are liking, subscribing, sharing, all of the things so that we can continue to just do great things in the world and get our message of health and wellness out and talk about why chiropractic is so sexy. And of course, today we're talking about why people don't change until they have to. And if you noticed, we have a new thumbnail. And if you go to our website, the name looks a little bit different. And so this is why we're going to talk about change today. Sometimes people want to change, but most of the time they have to change. And we had to change. And so I'll tell you why. Facebook, YouTube gives a strike because they said that we had sexual content and nudity based on the word sexy. That's it. Other than our nude faces. I don't know. Like, clearly a bot flagged the word sexy and decided that that wasn't acceptable. So I just went and tweaked it a little bit. And so we still are Chiropractic is Sexy. We are just SEKSY. So hopefully saying that won't, I'm hoping just saying that won't be a flag, but we'll see. We'll see. I don't know. I know, Tia. Yes. Listen, Tia, we missed the nudity too. Okay. So I think we all missed it.
We didn't see it either, but yeah, it might actually be the word, but we'll go forward with this way and hope that I'm sure the bots are more looking, well, I'm sure they're never going to set, like if they're translating or they're doing, what's it called? Closed captioning for us. I'm sure they'll never really pick up SEKSY, but that's what it is. So we'll be able to at least we'll see.
I mean, we'll go along with this. We'll pivot. It's silly. We all know it's silly, but we had to change it. Now, it was a little bit of a pain because I just had to go into the back end. I had to change the names all over the place. I had to create thumbnails. I had to create new banners. What I am not certain of is, do I have to go back and reload the thumbnail into our 75 episodes? So again, it's a pain. It's a process. And what's that?
It's going to be more like 120 episodes. Or more. We're over 2.5 years. So
yeah, let's go see where we're at. Mm-hmm. Yeah, it is a lot. It is a lot, which is I want you to remember that phrase, it's a lot, because I'm going to tell you a story about it's a lot here shortly. And I think Dr. Erica, we're at 167 episodes, you guys. Are you kidding me right now?
I know people don't make it. What did they say? Past 3? Like 99 something. Like it's like 99% or 95 or something percent don't make it past the 3rd episode. So
yes,
it's pretty awesome. Okay, so I have this patient in. He started care back on Tuesday. When was he here? Yesterday or Monday? He's been gone for like 6 months or whatever. Fell off the radar, back on. But anyway, in that 6 months, super proud of him because he's lost probably 45 pounds by cutting out alcohol, by nourishing his body, and by doing, a bunch of other different lifestyle choices. And he looks amazing. And so he went to so there isn't that, he's not required to change, but there's nothing in his like foreseeable whatever that he needs to change for necessarily. He was just ready to make the change. I think he's maybe 52 or 3. So he came in on Monday. He wants to start back under regular chiropractic care, which I'm super proud of him for that. And he said to me, he said, I went to the eye doctor last fall sometime. And he said, I had an issue with potential macular degeneration. It's not happening now, but he said, I'm in the risk for it. And so he went back this past week or 2 weeks and he said, my eye doctor said I'm no longer in the danger zone for macular degeneration. And I'm just thinking along the lines of, number one, he's getting adjusted again. But number two, he spent the last, I would say 6 to 8 months really revamping lifestyle, really getting back in touch. Now, I wish people would stick with chiropractic care because now he's like, I got this thing, which people say to us all the time. But I'm like, stick with chiropractic care because it's going to help just to take the nervous system down, give you more bandwidth for life. And then along the way, if you eat well, drink well, move your body, get your sleep, keep a positive mental attitude and get adjusted. Sleep was the second thing that he worked really hard on. And so I said, this is awesome. It's so awesome where you're at right now, but this is what I want you to do. I said, I'm super proud of you. Your health has made major changes. In the fall, he's a teacher. In the fall, you're going to go back to the classroom. I want you to think right now, what are the things you can put into place? What are the habits? What days of the week can you put your workouts in that's going to fit you when the fall starts again, when the winter comes? Like, yes, it's so awesome, all the changes. And I said to him, it's so awesome that you made all these changes because a lot of people wait until they have a severe health crisis before they actually do that. And so as he's seeing all these other things kind of unwind in his body, it's really, really awesome. So yes, change is often required from a health crisis. Super proud of those that are making changes just because they need to make some changes.
Love and that. I often wonder how rare or how common that is, where people make changes because they don't have to, where they're just like, they're just really not feeling great. And that's part of the inspiration for coming up with this topic this week was because we had to change the name. And it's not like it was that big of a deal, but it's change. And I think a lot of people have resistance to change. And again, there's a lot of moving parts to make sure that I have to change it in multiple places. So it's a process, it's a thing, it's clunky. And I think a lot of people will take that, and when we apply it to our lives, it's a process, it's clunky, it feels different, it's foreign. And so no matter how bad the bad is, if bad is comfortable, new can sometimes feel uncomfortable, even though we know it'll be better. So people will often stay in that poor place. And so I had this patient that came in, and I think I've told this story a couple of times, but I think it's just worth repeating. It's a great example of what happens when she had been through the medical model. She wasn't feeling great. She's going to be 60. She's roughly around that age, in that very common place of, I feel like complete garbage, but my doctors tell me everything's normal. She has been under stress for years, she said, like complete nervous system dysregulation. It's showing up in her gut health, in her mental health. She's not sleeping well. She has none of the lifestyle habits on deck. And she said, I don't know what to do. And I don't know why. And she also said, I'm doing everything right, but she's not. She's doing everything right according to the medical model. So one of the examples that I uncovered was that she has been on an acid blocker for 20 years. And when you're on that kind of medication for that long, it's only meant to be short term. You're reducing the body's ability to absorb building blocks of nutrients that you need for healing. And it changes how the brain works because there's a gut-brain connection. So think about this. You have a symptom, you go to the doctor, you're given a pill. And then I give her a write-up, and I'm like, this is what it's going to require. And I hit all the lifestyle pieces plus chiropractic, nutrition, all of that. And she replied back and she said, that's a lot. Wow, that's a lot. And she said, I don't know that I want to commit the time or the money to that. And I said, it's a lot because it's different. You came to me for different. You didn't come to me for same. And if I were able to just give you one thing to take care of it, I would. But I'm not the medical model. I can't just give you a pill for your digestive issues and say, okay, go away and I'll see you in 20 years. That's not how it works. So this is somebody who it's going to chronically get worse until she then gets to another level that's even worse. And God forbid any, disease comes from it. But oftentimes, sadly, Dr. Eric and I see it where people are like, yeah, I don't want to do anything. I don't want to do anything. And then suddenly cancer diagnosis. And I don't want to say that to scare anybody, but you guys, it's so common. Dementia, Parkinson's, Alzheimer's. We see these things as it's like the end process of all the things that we know we could have potentially impacted for years. If people just came when they first started having those issues.
We talk a lot about, well, I'm just going to bring this through this way, but we talk a lot about AI these days and thinking about the medical doctors that are getting their degrees using AI these days, right? So what I love about our profession is that nothing takes away from ever being able to do that without my hands. But so then what do we do about the medical model that's going through and getting their degrees using AI, right? Or using ChatGPT for their answers and stuff like that. And this is your answer. Take even better care of yourself. Take even better care, because quite frankly, I'm not interested in those kinds of models. And I just had this long discussion this morning about the medical model and HRT in particular. And it's like, you talk about it before, it's this titration. It's like things are going a little bit haywire. Then your body does its best to adapt to that. And then it goes a little bit more haywire and body steals. And so hair is falling out because the body needs the minerals and it doesn't care about the hair. It cares about the vital organs. Or whatever. There's so many different symptoms, but the body starts adapting to crappy lifestyle choices. And now all of a sudden we're in this severe diagnosis, but this has been going on all along. And now those that are diagnosing, quite frankly, I don't want to be under that kind of care anyway. So what can I do? What can we all do? Take even better care than ever before. Mm-hmm. It is a lot. It is a lot. And patients say, well, for how long? I'm like, the rest of your life. Mm-hmm. Like, there's no way around it. So how long do I have to do these stretches for the rest of your life? How long do I need to tend to my body and like tenderize my muscles for 20 minutes a day, which is what we always recommend, the rest of your life? How long do I have to walk 20 minutes a day or do the equivalent of a workout every single day, the rest of your life? How many days do I have to do this like hydration thing the rest of your life? And there's not a silver bullet out there. And but it's always like, let's not wait until the major health crisis. Now, that doesn't mean that Dr. Paula and I are immune to health crisis. We're not. None of us are. We're never promised a tomorrow. And there's quite a bit of, in my world, in my circle, there's quite a bit of like death, all different ages going on in my practice too. And we're not promised a tomorrow, so take even better care, because, it's like all of a sudden it's flipped off the edge, but it's been headed towards that cliff slowly.
Yeah. And it's just taking that first step. That's the biggest thing. Yeah. And understanding. And one of the things I explained to this woman, and I said, well, what we need to do is meet again so that let's simplify it. Let's come up with and the original plan I sent her, it wasn't complex. It was just, is different. And I mean, I say it wasn't complex from my lens, but it probably was very complex to her because again, it's an approach that she was foreign to.
Right.
But I did share with her, and I said it in a very loving way. And I said, where you're at today, I'm just going to paraphrase what I said, and it's going to sound really bad, but I promise you I said it a lot better. But basically I was saying to her that what I see is that you're saying you're going to put it off now, and then months will go by, a year will go by, 2 years will go by, and 5 years will go by. And then you're going to wish that you had taken action when you had the opportunity. When you think today you feel really badly and 5 years goes by and now you feel even worse, and then, or you're dealing with some weird autoimmune thing, or again, God forbid, some chronic diagnosis, some neurodegenerative issue, which we see a lot of, we're seeing a lot of neurodegenerative issues these days. But that's where it's like, I don't want you looking back 5 years from now and going, I wish I had. Yeah. I wish I should have. I wish we want the best of health for everybody. So, our goal is really just to help people understand, like, let's just take action now in small steps. And I send people all these, we talk about, okay, if it's money, and with that write-up, she has a plan. Like, I basically gave her a plan, and then I send her my recipe booklet, and I send her shopping lists. And I do that for every single one of my patients, because I'm like, here's all the free ways that you can get healthy if you never walk back in my office. You still need regulation in your nervous system. However, this is going to help you eat better, and this is going to help you regulate your sleep. This is going to help you regulate your mood. So it's really critical that we just start taking those first steps. And if you feel badly, it's for a reason. Your body has decided that it can no longer adapt and optimize itself. There's a problem. It's a signal. We've had that conversation many times.
Yeah. Yeah. It starts at a whisper, right? And then it just gets louder and louder and louder. And so there was a comment up here. The old axiom was, before you seek to treat a man to make them healthy, first ask them what they're willing to let go of that makes them ill. And, Dr. Paul and I have our own vices too, that sometimes I find myself in a sabotage mode. I'm looking for a dopamine hit of some sort. And so I'm like going for dessert, or like last night I was at a neighborhood party and there was like the most delicious chocolate cake. But I just know that when I get also, I'm not going to drink a whole bunch of alcohol on top of that. I'm just going to have cake, chug a bunch of water, and go to bed because it was so delicious. But there's all kinds of things. And also we're getting adjusted every week. We're getting, we're doing the things that prep us to be able to do what we want to do tomorrow, to do what we want to do in 5 years and 10 years. I went to a Tony Robbins seminar years ago called Unleashing the Power Within. And he was talking about something you had mentioned, which was like, okay, take your state, how you are today, and maybe do a review of systems, do a review. So for him, it was more mental, emotional, but in that seminar. But for us, we could take it as chiropractors and just say, okay, I've got, today I have light tinnitus in my right ear. That's probably from the cake I ate last night. It comes from the gut or whatever. Okay, now take how you are, do a body review, and then multiply that out to a year from now. If your body keeps headed down that path, what is it like a year from now? What is it like 5 years from now? Multiply it by 10 years from now. Get yourself out from this point forward to your 75th birthday. What is that going to look like? Get out to your 80th. What's going to be your 6th, 7th, and 8th decade, 9th decade of life going to look like if you keep down the path where you're at right now? And what can we do to set it in the right motion? And so when Dr. Paul is talking about that woman said, that's a lot. We do understand that we give you a lot. That doesn't mean you need to take all 25 steps that we've given you. What it does mean is that get your nervous system checked so that you have more bandwidth for the stress that bombards us every day. And then use that bandwidth to make 3 or 4 choices. Flip over one rock, do one thing, do one thing or 5 things out of the list of however many you get, and start to head in the right direction, because it's all very slow until it's all of a sudden titrated to a disaster of a body and disaster of health. So we talk about things ad nauseum too, ad nauseum.
I know. If you've been here before, it's just the message tied up in a different package every week.
That room.
Yeah. So this comment, I have the beginning of glaucoma and learned recently from my eye doctor that glaucoma is linked to Alzheimer's. What should I eat, drink to prevent Alzheimer's and keep glaucoma from worsening? So let's take this bird's eye view. Let's take a 30,000 foot view of that. And that you have been developing glaucoma for at least 10 years. You don't have the beginning of glaucoma. You had the beginning of glaucoma 10 years ago. That's how those types of chronic diseases work. And the reason it's tied to the Alzheimer's is because you lack the nutrients, like glaucoma, macular degeneration, all of those eye issues. That's eye health from poor nutrient absorption. And your brain it's no different. So yes, it's probably likely, and I don't know if that's correlation, causation. I don't know. Just trying to answer that question. Just from a high level perspective, is that anytime the body does not have the resources and the building blocks, things are going to go wrong. And it happens slowly until it's the titration effect that Dr. Erica mentioned that I always talk about. It's like one drop of potassium permanganate in clear water, one drop, until 100 drops later, the whole thing turns blue. It takes one drop to turn it blue, but yet that thing's saturated with potassium permanganate until that extra drop comes in. That's what your beginning of glaucoma is. You are titrating up, and then boom, now you have a diagnosis of beginning of glaucoma. So what can you do? That's a big question, and we don't have time to answer what should you eat, drink, and prevent that. But you have to clean up your diet, like get rid of the processed foods, the seed oils, eat water, like all the things we talk about on this channel.
So one thing I was going to say is, what should you do? And here's the number one thing not to do, is to go directly to the medical doctor and ask them that question, because this is one of the things we're trying to shed light on all the time. Yes, it's a medical diagnosis. Yes. And they don't have answers for that, because most medical doctors, most general practitioners, as well as all the specialists, they're never addressing the things that are getting us to this point. You didn't catch the glaucoma from walking by somebody with glaucoma. We don't catch cancer. We don't catch other chronic illnesses and diseases. I'll give you this. We can have a genetic propensity, potentially, but lifestyle choices are what get you there. And that's why we're here talking about this, because you want to start asking different people, what can you do? So thank you for asking that. What can you do? We don't know you specifically, so we can't really say what we can do, but can tell you could run functional medicine down, which Dr. Paula does functional medicine. We can look into, there's probably like potentially high A1C somewhere. Mm-hmm. There's, fasting who knows, blood sugar regulation, usually metabolic health. Right. Dr. Paula, constant metabolic health. So there's a lot of things, but just like she said, it's not that it all of a sudden happened. It's been going on, but that's also, I love that you're asking the question to us, and that I want you to look for somebody in your sphere of influence and in your sphere of healthcare, or seek somebody out for true healthcare rather than just looking for illness and sickness and disease. So it's an awesome question, because there's a lot that you can do lifestyle choice wise. Yeah. My grandmother and my sister both had Alzheimer's, and I know my grandmother had, So yes. So it's such a great question. It's a great question now. It's a great question for tomorrow. And then it's also so important to take the small actions that start to, should you go low carb? Who knows? But it's probably a good choice. We can't really say that from here. If you were in our offices, we could be able to do that, or seek us out. Aside from that, but there's potentially a genetic propensity, but all those genetic propensities, the trigger is pulled by lifestyle. It's called epigenetics. So we have genetics, but our genes are covered. And so lifestyle choices lift the genes up, or lift the covers up, so the genes can be expressed. So we can use lifestyle choices and have genes lifted that are for health. And
there's plenty of people that you have that genetic propensity. And if you know that, and you see what's happening with your generations ahead before you, you can say, oh, okay, heart disease, Alzheimer's, what are the things that I need to be doing? And I know you've asked the question is, what can you be doing? So I think we're trying to answer your question the best we can, but it's a great question for everybody, in that, especially when it comes to anything neurodegenerative, anything in the brain, there's always an inflammatory component. I call it brain on fire. There's usually food sensitivities, chemical sensitivities. And again, there's always a gut issue. So I would definitely seek out gut healing, gut repair. We've talked about that. I've got a bunch of videos on my channel with regards to to gut healing and gut repair. We have that gut-brain connection. So if the gut is not properly working, then the brain will not properly work. The gut will send toxins to the brain that creates more neurodegeneration. So you just have to start asking yourself, what's going on with my body from the broad picture? And if other people in your family had these diseases, then you can also ask, how did they eat? What was their lifestyle like? What were their stress loads like? Did they sleep well? Did they have autoimmune issues? Were they on medications that perhaps caused that level of disruption? And if you find that you're walking down that same path, then you gotta take a different path.
Yep. So also another great question is, what do we know about GLP-1s? So that's like a huge can of worms to open. And I personally would say they're decent as a bridge. They are never to be used long-term. But it also is something you have to look. I would never recommend it ever, mostly because we have patients in our offices that were put on them and kept on them now, and they've had like large sections of their digestive system have to be removed. Just all the things like and we just don't have any research down the way. So yes, be super mindful, do your research. And it's definitely, it's trending. It's definitely, I don't want to call it a fad because it does feel like it might be here for a while, but you do have to know that all of those, they call them side effects, but they are actual effects. They just use the word side to make it be like not such a big deal. Well, it is a really big deal when you have sections of the intestines removed, bodies wasting away, and muscles also wasting away. So it's something to do a whole lot of research on way before doing anything more. And also, I was just thinking about this because Tio Mimo says research studies show the use of psychoactive mushrooms have significant impact on reversing Alzheimer's. It's such a really interesting avenue for health and studies and all that, for sure. And also, it's one of the things. So I have a big wellness center. I'm chiropractic, massage therapy, supplementation. I have an infrared sauna inside a big wellness center, but I also have mental health therapy. I also have actually OT. I also have speech therapy and other therapies, and now a medical doctor is moving in with us. But it's like, it takes everything always. And it takes looking and asking questions like we had talked about before of the right people, bigger questions. So yeah. So thank you. Because mental health factors into it too.
And these questions, and it's no fault of your own. You've been conditioned as society to be very reductionist. So if I have this, I do this. If I have that, I do that.
Right.
And so Dr. Erica's Wellness Center, it is global, it is broad, it is holistic. It is designed to take a 30,000-foot view and come at you with all hands on deck. And I left the GLP-1 comment up there because I want to comment on that, that this is not, you can't out GLP-1 a poor lifestyle.
Thank you.
So, and when it comes to like even hormone replacement, GLP-1s, any of that, I have patients who have gone on GLP-1s and they are still metabolically unfit. They are still metabolically sick. They are still on a metabolic freight train towards chronic disease. So just going on just deciding you want to lose weight, and I get it, like there's health issues, but it has to be a metabolic path forward. So you've got to do the lifestyle things. And that's where asking the right questions and working with somebody who's able to guide you, like somebody like me or Dr. Erica, or somebody within that sphere to be able to help you down that path. Because you can't just go, I'm going to go on GLP-1, but you still have poor gut health. You're having 2 bowel movements a week. You're not sleeping well. You're not hydrating. This is so common in my patients who've gone on these medications. And so thinking about it from that perspective. And then also even with HRT, hormone replacement therapy, if you are not putting all of the lifestyle building blocks into place, then you can't out HRT a poor lifestyle. It goes without saying. Yeah. So, and then the last thing about the patches, I don't know about the patches. So I know GLP-1s are effective as injections. And so this is also where it is the wild freaking West out there that you're like, oh, the patches, that's good. I don't have to inject myself. But do they work? Do they work like, and what's safer? I don't know. I don't have the answer to that question, but I would ask, how does this work? And if they go, oh, it just works transdermally. No. What is the actual like biochemical action? When it goes through the skin, where does it go? How does it get to where it needs to go? And how does it do what it does? And what's the effectiveness of it? And people, you can't just say safe and effective. That doesn't work. We're out of that phase. So you might be wasting your money if you're like, well, I want to go on the GLP-1, but I'm going to do the patch because I don't have to inject myself. That's sheer speculation, you guys. Yeah. But that's how you have to look at those things.
Right. So we have patients that have had so many different experiences. I've never been on a GLP-1. Dr. Paula hasn't been on a GLP-1, but we do work with people that are on them. And it's also just like Dr. Paula. I mean, you're going to hear that ad nauseum. You can't out blah, 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 a crappy lifestyle. You can't out GLP-1 a crappy lifestyle. You can't. So as we go back and we talk about even the glaucoma, we will always sit on our principles of eat well, move well, think well, drink your water, get your rest, and get adjusted. So that's what you can do to help. Like, that's always going to be our answer. That's always going to be sort of like, that's our foundation as chiropractors of where we sit. There's a lot more to lifestyle that, are out and beyond that, but that's the basis. And there aren't any shortcuts. And I say this to the patients all the time. There aren't any shortcuts. And if there was a shortcut, like, it wouldn't be called a shortcut. It would actually be the way, right? So it wouldn't be even called that. It would just be like, this is how things go. So if you're like, okay, there's got to be a silver bullet out there. There's got to be a one shot, one prick, one, supplement that you could throw at everything, but it's just not. And no matter what you're doing, if your nervous system is more regulated, you're going to make better choices when you eat. You should be drinking water no matter what, because your nervous system needs that. But your positive mental attitude, it's astounding. I just had a mental health therapist on the table. It was her second visit today. And I said, I've often wondered if people could get adjusted and then go to the therapist, like get adjusted as a couple and then go to a therapist. You guys might think we're wild to even say something like that. But if you've never been adjusted and you could feel the effects of what an adjustment does to the entire body, you would start to understand that. I would love to run a study on like couples therapy and getting adjusted on the way into the therapy. Like, let me set a table up right outside. Then you go talk to the therapist and then, get a little body work or something done and get on with your day. And it would be a way better life. Everyone's redlining everywhere.
It's amazing.
Yeah.
And this question by Lily, or comment, I just watched a video that listed healthy vegetables that are bad for your kidneys. It also listed vegetables that are good for your kidneys. So this is what makes me crazy in the world of influencers, is that Dr. Erica and I are here just to help prevent this level of confusion. And if I can just guess what they were talking about, they were probably talking about brassicas, like broccoli, cauliflower, collard greens, anything in that particular family, because they are high oxalate formers, which can cause kidney stones. Okay. That's a whole different thing. I'm just making that statement that I think that's what they're talking about. But did you also know that broccoli has a compound called sulforaphane in it, which helps prevent cancer? So these people, and like Dave Asprey, who's like the master of biohacking or whatever, he's a D-bag in my opinion, but whatever. Okay. It's my inside voice, but he's like, broccoli's disgusting and nobody should ever eat broccoli. And I'm like, dude, like, people are just they just need less confusion. I would rather you eat broccoli than a Snickers
Doritos.
Doritos, exactly. And so what that does is it creates enough confusion, then it creates frustration, and people are like, well, why should I change? You told me broccoli's bad. I'm just going to keep eating my Doritos. So thanks for posting that, Lily, because it's a great example of just, in my opinion, it may not be misinformation. It's just poor information.
Yeah,
So,
you guys are awesome with the comments today. So thank you so much. I'm going through menopause now and may have my last cycle. So what do I need to do besides cut down processed food? Should I go on the Mediterranean in my diet? So we're both going through it. We're with our patients going through it. We're in it. Blanket statement, I would say from my perspective and in my opinion, is that more whole foods, the better. And that doesn't mean anything except for if you're reading a bunch of labels, you're not eating the right thing. If you're looking at something and saying, this is broccoli, this is chicken, this is whatever, you're on the right track. So that is just a blanket statement of more whole foods. The more life you can put into the body, the more life you're going to actually give to the body. Like if I take something out of a box that's already doesn't have any life in it anyway. And so it doesn't mean don't lightly cook things and saute things. But one of my mentors, he says, if it walks in the garden and swims in the sea, I'll have to look up the line he says, but it's always like, if it grows or walks in a garden or it swims in the sea, something like that, it's going to be like good for you and me, or so, I can't remember how it went, but just thinking about more whole foods in general. So, and the
Mediterranean diet has never, it's never made anybody sick. And what I mean by that is that there are a lot of diets out there that are not for everybody. And we could just say the vegan diet is, in my opinion, very few people can successfully be on a vegan diet long term. But the Mediterranean diet that's adopted by centenarians. It's adopted by communities who have super longevity. And so I'm Lebanese. My aunts and uncles are all in their 90s. Mm-hmm. We have longevity on we're locked on the longevity piece, and that's how we eat because it's just how we were raised. So I think like, don't get into like, a lot of times, and women will be like, I should do keto because so-and-so did keto, or I should do vegan. Nope. This is one thing where I would say you can't go wrong with the Mediterranean diet. Just do that. And that's exactly what Dr. Eric is saying, is it's whole foods, it's heavy on protein, it's light on grains, there's no processed foods, there's healthy oils and fats. You'll feel amazing. You'll get energy, and that just following that will help you clean some things up. So
I love it.
Yeah. Yeah.
Well,
so we probably got to shut her down for, we went long, but you guys are amazing. I also want to thank Serena Norel for being here, because we've not seen you before. So thank you for tuning into us. We appreciate you being here. So make sure you are subscribing, hitting the like button, hitting the bell, getting notifications, because that will also help you through menopause. So, because we will be here for you.
I think you might know the grumpy guy, but I don't know the grumpy one either. So
yeah, grumpy guy's been here before.
Oh, and Zelene. I don't know that name either, but that's just me.
I don't know Zelene. Hi, Zelene.
Yeah.
Oh, hi, Zelene. Yeah, Zelene is new. Yeah.
Love that.
Okay.
So yeah,
awesome.
Shout out to
lots of new faces in here. So thank you guys so much.
We're no longer with the X. We're like the KS.
We're the KS. Yes. Yes. We're gonna figure this out. If we get flagged again for being SEKSY, I don't know. It's gonna be crazy. So so we hope to see all our new faces again next week. Again, please share. We're looking to grow and get this message out and cut through the confusion and the BS for you guys.
And bring all your questions too. We love it.
Yes, please. So, and Serena or anybody, you can also just send us an email through our websites, and we'll be happy to answer any questions for you that way as well. So thank you guys for being here. We'll see you next Thursday. See you Sunday too for Sunday Night Live. Okay, talk to you soon. Love y'all.